Hello, and welcome to Chapter 35, Infection Control Practices. Please take a moment to see and read the learning outcomes for Chapter 35. In Learning Outcome 35.1, we will identify various healthcare associated infections specific to the ambulatory care setting. There are common risk factors associated with HAI, healthcare associated infections. They are use of catheters and other indwelling devices, surgical procedures, healthcare environment contamination, communicable disease transmission between patients and healthcare workers, improper antibiotic use, and immunocompromised patients. MRSA, MRSA, or methicillin-resistant Staphylococcus aureus, is an infection caused by a specific type of staph bacteria, which become resistant to most antibiotics. An invasive procedure puts a patient at risk for a MRSA infection. C. diff is a type of bacterium that causes diarrhea as a result of taking antibiotics for prolonged periods of time. It can affect persons of any age, but is especially concerning to the elderly. It is transmitted by the fecal/oral route. A central line is a catheter that is placed into a large vein to give fluids or medications. With catheter insertion, bacteria can enter the urinary tract. Medical asepsis, or clean technique, is based on maintaining cleanliness to prevent the spread of microorganisms. The goal of medical asepsis is to reduce or control microorganisms after they leave the body. Surgical asepsis, or sterile technique, depends on a completely sterile environment that eliminates all microorganisms. The goal of surgical asepsis is to keep organisms from entering the body. Medical and surgical asepsis are required by law. OSHA, the Occupational Safety Health Administration, has special recommendations for workers who perform procedures that could result in a patient's exposure to disease. There is still controversy about requiring testing of all healthcare workers for HIV or HBV, but no current recommendations for testing. In Learning Outcome 35.3, we will describe various methods of injection safety, including safety engineered devices and work practice controls. The One and Only campaign is a public health campaign led by the Centers for Disease Control and Prevention, otherwise known as the CDC, and the Safe Injection Practices Coalition, the SIPC, to raise awareness among patients and healthcare providers about safe injection practices. The campaign aims to eliminate infections resulting from unsafe injection practices. Safety engineered devices can reduce the incidence of needle sticks. Self-sheathing needles require two hands to activate, which can be very difficult. Retractable needles and capillary puncture devices are for single use and keep the lancet away from the user. Self-blunting needles or blunt tip blood drawing needles can be activated while still in the patient's vein and then removed. Resheathing scalpels are single-use disposable devices that can be used with one hand. Needles with add-on safety features are either a hinged or sliding sheath attached to the needle to keep the user's hands behind the needle. In Learning Outcome 35.4, we're going to summarize the proper respiratory hygiene/cough etiquette practices used in the medical office. The CDC will provide free posters to remind staff and patients that influenza and other serious respiratory illnesses like respiratory syncytial virus, RSV, whooping cough, and severe acute respiratory syndrome, SARS, as well as COVID-19, are spread by cough, sneezing, or unclean hands. To help avoid the spread of germs, the following are required. Avoid close contact with people who are sick. Stay home when you are sick. Cover your mouth and nose with a tissue when you cough or sneeze. Wash your hands often with soap and water for 20 seconds. If soap and water are not available, use an alcohol-based hand rub. Avoid touching your eyes, nose, or mouth. Practice other good health habits. Clean and disinfect frequently touched surfaces at home, work, or school, especially when someone is ill. Get plenty of sleep. Be physically active. Manage your stress. Drink plenty of fluids. And eat nutritious food. Special precautions may be necessary during a local or regional outbreak of respiratory illness. Patients who are coughing may be asked to wear a mask or to be isolated from other waiting patients. Hand hygiene is stressed, along with decontamination of the exam room, surfaces, and medical equipment. In Learning Outcome 35.5, we will describe infection control procedures related to medical equipment. Non-critical equipment includes blood pressure cuffs and reflex hammers, which only come into contact with skin and require low-level disinfection. Semi-critical equipment includes endoscopes or other items which come in contact with mucous membranes or non-intact skin. At a minimum, these require high-level disinfection. Critical equipment includes surgical instruments or other items which enter sterile tissue, body cavities, and blood vessels. These pieces of equipment must be sterilized prior to use. They need to be wrapped and require sterilization indicators. In Learning Outcome 35.6, we're going to describe surgical site infections, or SSIs, and ways to prevent them. Patients should be given instructions in writing and verbally before a surgical procedure. A workplace culture of safety should be developed where everyone feels safe to speak up or even stop the procedure if the protocol is not being followed. Patients should be treated as part of the safety team in preventing SSIs and be aware of the warning signs after the procedure. The invention of the autoclave sterilizer is attributed to Charles Chamberlain in 1879. An autoclave is used to sterilize surgical equipment, laboratory instruments, pharmaceutical items, and other materials. It can sterilize instruments of various shapes and sizes. Autoclaves vary in size, shape, and functionality. A very basic autoclave is similar to a pressure cooker. Both use the power of steam to kill bacteria, spores, and germs resistant to boiling water and powerful detergents. Biological indicators, or BIs, are the most accepted means of monitoring the sterilization process because they directly determine whether the most resistant microorganisms, for an example, Geobacillus or Bacillus species, are present rather than merely determine whether the physical and chemical conditions necessary for sterilization are met. Because spores used in BIs are more resistant and gather in greater numbers than the common microbial contaminants found on patient care equipment, an inactivated BI indicates that other potential pathogens in the load have also been killed. Each autoclave will have a specific manufacturer guidelines that need to be carefully followed. Chemical sterilization is typically used for devices that would be sensitive to the high heat of steam sterilization and for devices that may be damaged by irradiation. Rubbers and plastics can become more brittle. The 5 steps of clean, disinfect, rinse, dry, and store for a uniform process to prevent recontamination. Examples of chemicals used are ethylene oxide, ozone, bleach, formaldehyde, hydrogen peroxide, peratic acid, and silver. In Learning Outcome 35.8, we're going to describe the CDC's requirements for reporting of cases of infections. A notifiable disease is any disease that is required by law to be reported to government authorities. The Coalition of Information Forms may vary. The information required is standard and includes disease identification, patient identification, infection history, and reporting institution information. Reporting is done either on paper forms or electronically.